I think about it every day. Doesn't go very far from your mind, that's for sure. But you try and put it aside and just live the best life you can. It was in 2016, and actually we were in Florida at the time with our daughter and grandchildren and her husband, and I had developed a cough. I went into my doctor about March, said come back and see me in 3 weeks if it isn't any better. So it didn't improve. So I went back in 3 weeks, and he let me know that there was a problem. And he just got me into the Oshawa Cancer Clinic immediately.
I met Џенифер over 3 years ago, and at the time she was diagnosed with an advanced lung cancer. It was one of those situations as a never smoker where it's a complete shock, and how can this possibly be happening, and why did this happen? We did the initial testing, and a few years ago we were still doing single gene testing, and to a certain degree we still are doing single gene testing, and she was negative on those initial tests. And I had brought up the idea of genomic profiling.
So it was in about July that Dr. Rothenstein started talking about this genomic testing option, and he explained that it would guide him in his decisions about treatment plan, which was very helpful, I think, to have those options available.
When I talked to patients and when I talked to Џенифер about the genomic profile, we spoke about this idea of having a toolbox or toolkit, and wanting to use the right treatments at the right time during the course of treatment for her disease. So we actually started off with chemotherapy. And the chemotherapy worked, and it took us to a certain point in her treatment. But during the treatment, we got that profile back, and it gave us information that she did in fact have an oncogenic driver. The nice thing was to have that option in our back pocket so that we knew, okay, we're on a path, but we've got plan B covered.
It's funny, I'm a control freak, and this is something that I've had to live with. I can't control what my body is doing anymore. But I think Dr. Rothenstein has picked that up fairly quickly, and he knows I need to have a plan. I need to be in control as much as I can be.
She went on that treatment, and the treatment worked really well for her, and she was able to kind of break free of the chemotherapy side effects and go on this targeted therapy, which really allowed her to live well, have a good quality of life. We're at the beginning of this transformational journey with comprehensive genomic profiling. As time goes on, I think we are evolving to a place where genomic profiling will be part of the routine when a patient gets diagnosed with cancer.
I think I'm very lucky to be in this age where there is a lot of emphasis put on research and development. In addition to the wonderful medical care that I have received, I've really have had wonderful support from my family. It's very important that we talk about it and explain what's happening to us.